Leicester, a city at the heart of the East Midlands. It's a diverse and vibrant city, but when it comes to health, it's a city with more than its fair share of problems. In Leicester, almost a quarter of adults smoke and nearly 1 in 5 drink too much. Stroke rates are also far too high, and heart disease and heart attacks are the commonest cause of death in the city. More than 1 in 4 adults are obese, so are far too many children. Teenage pregnancy rates are above the national average. Mental health problems affect 1 in 3 people here, and suicide rates are also high. What's more, depending on where you live in the city, there's more chance you'll die early. That's why NHS Leicester City, which oversees healthcare here, has announced it will be focusing on the 4 things it believes will make the biggest difference to the health of people living in the city over the next 2 years.
The 4 big issues are improving primary medical care, that's the services provided by local GPs, improving the quality of mental health and wellbeing services across the city, and reducing the number of premature deaths caused by cardiovascular disease, that's heart attacks and strokes, and finally increasing our capacity in terms of intermediate care and rehabilitation.
Plans unveiled include spending more than £6 million on improving the services GPs provide, such as longer hours at even more surgeries, and making sure older buildings are up to a good standard. They also encourage more patients to use their community pharmacy for advice on common conditions such as coughs and colds.
These extended hours are actually important for patients because it gives them opportunity to see the doctor at their own convenience. It also gives them an opportunity to get the right treatment at the right place at the right time. And at the same time, we're actually reducing the burden upon services like the A&E, which are currently overwhelmed with people going to them after surgeries are shut.
Often it's our lifestyle which is to blame for ill health. An unhealthy diet, smoking and lack of exercise are among the major causes of cardiovascular disease such as stroke. Many problems can be prevented, which is why nearly £2 million is being invested in initiatives such as a pilot vascular screening programme for 40 to 74-year-olds.
Early screening is very important for the simple reason then we can find out much sooner as to what is wrong and when the strokes are going to happen, we hope. This is the idea of the vascular screening. It does help a lot in that way.
We live much more stressful lives now, and anxiety, depression and dementia make up many of the mental health problems which affect 1 in 4 people in the city. But there are measures now being put in place to help make things better, including spending £1.4 million on improving access to therapies and identifying problems sooner.
People's perception of mental health is someone running down the street with a machete, and it's very, very important for people to recognise that mental health come in different forms and shape. For example, postnatal depression, someone having a bereavement in their family, someone losing their job. So we really all need to be behind mental health and try and remove the stigma from mental health.
For many conditions, hospitals are not always the answer, and the money spent on long-term care could help more patients be looked after in the comfort of their own home instead. More than £2.5 million is to be spent on improving intermediate care and rehabilitation.
It's ideal because they can actually manage their own condition in their own home, and that's often the place they prefer to actually be. So we can actually give them the right treatment at the right time and in the right place.
Those working at NHS Leicester City are already spending money to improve health in the city, but over the next 2 years we'll be investing more with these proposed improvements. In 2009 and 2010, £1,800 will be spent for every man, woman and child in the city. That's £536 million now. That'll all help improve other aspects of the local health service, like keeping down the rate of hospital infections like MRSA, increasing choice for mums-to-be, putting outpatient services nearer to where people live, preventing diabetes, reducing childhood injuries, and helping overweight youngsters and their families.
We've made a lot of progress over the last 2 years, but there's considerably more we want to do, and these plans set out ambitious proposals that will inevitably, I think, improve the quality of healthcare available to people in Leicester, but also to improve the health of the people of the city.
Leicester and the people who live here have every chance of a full recovery, but no one is taking anything for granted. In 2 years' time, we'll be back to find out whether the plan has been a success.